More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern-day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Welcome to this episode today. My name is Josh Rimini, pharmacist turned healer. And today I have a really special guest, Mark Durante. He is the founder and CEO of RIZE Medical, which is a company dedicated to empowering medical practitioners to incorporate cutting-edge regenerative therapies into their practices, enhancing patient care and transforming lives. Mark helps practitioners identify and integrate innovative biological products into their practices, focusing on delivering exceptional patient outcomes while maximizing profit at the same time, which is what I've been teaching pharmacists for a very long time. Welcome, Mark Durante.
Thank you, Josh. I appreciate it. This is going to be a wild conversation because just like you've been trying to teach pharmacists, I tell people this has been kind of a couch conversation with God, or as you like to call him, Gus. Where I started kind of thinking in my own health situation is, hey, God, is this some sort of sick joke that after a heart transplant, I'm literally near disability when I ran into this regenerative space? And it ultimately turned into a passion project. And I know you and I have so much that we can talk about here, but that is how the company RIZE Medical came about, because it was all about elevating physicians and elevating patient care.
And your story is pretty compelling as it relates to your own personal health journey. So if you don't mind, let's dive in and see, let's get to that origin. Let's talk about where you came from and how this thing evolved for you.
Yeah, well, I've been doing, I really spent a lot of time launching laser and radio frequency technologies in the medical aesthetic space back in the late 90s, all the way up till the moment I wound up having a heart-related issue. But the reality is that it started with the simplicity of getting neuropathy that nobody could explain. And through trying to go through all the diagnosis to try and figure out what was causing this, it was discovered that I had a heart issue. And by the time I figured it out, I was at half the heart function. Now, fast forward about 3 years, I suddenly go from a half heart function to I walk into a hospital with a 5% ejection fraction. I mean, the doctor looked at me and said, I don't know how you're talking to me, and I don't even know how you walked into the hospital. And ultimately, that led me to be put on the transplant list. I went through a heart transplant about 10 months later. And honestly, I went through a little bit more of a more difficult or challenging thing there, because I wound up having to have 2 LVAD surgeries just to get to the heart transplant. And ultimately was about 2 days from dying is what the doctors told me when a heart came through. But you'd think that that was the end of my story. And ultimately, after the heart transplant, we thought that the neuropathy would go away, because in most cases, the blood flow is not getting to the feet and the legs. And so it just naturally leads to nerve degeneration. And as time went on after the heart transplant, I wound up getting worse with the neuropathy, so worse that I was on 675 milligrams of Lyrica, tramadol, and hydrocodone just to circumvent the pain. And there was a time in that period where I was starting to have discussions with practitioners about going on disability, because I didn't know how I could function on a daily basis. I mean, just even doing a simple exercise routine took me 3 days to recover. And it was at that point in a desperation that I was working on a project with an orthopedic surgeon who'd been in stem cell therapy. And we were just having a after hours conversation. And he said, Mark, look, I'm going to be honest with you. If I couldn't get your disease completely reversed with some sort of regenerative therapy, I bet you I could get you part of the way. And so it was at that moment, and it purely was desperation. I said, let's do it. And and that kind of led me down the path of regenerative medicine, because I started in one avenue where I was taking from self, in more of an autologous fashion. And I think you and I will probably talk about that in the future, to a point that led me down to doing more of an allogeneic or from a donor tissue in order to regenerate my body to the fullest it is now. And when I say regenerate, I probably say to people, I'm about 95% better than what I was just sitting there 8 years ago. And the reason why I like to put out there 95% is because I still deal with a little bit of neuropathy, but it's manageable to the fact that I haven't been on medication in over 2 years. And I did that all just through biologics. And, but what happens is when those areas kind of get comfortable, Josh, you just start working on other areas. So I started moving to my spine. I started moving to my knees, my shoulders, and just started to do a total body rejuvenation. And then that led me into a whole bunch of other elements, which you talk about on your show, which I love because the story is about a body, mind, and spirit, experience. And I think this is a great segue for us to kind of bring in a multitude of things, that was along the way, because even today, biologics just isn't the only thing. I constantly am doing mental work to try and improve myself. I'm also engaged in other supplementation like NAD, methylene blue, ozone therapy, you name it, all these things that are playing a big role in the regenerative or longevity field in order to make sure I feel good every single day.
I love it. It's amazing because, you know, I love the synchronicities, right? The things that are happening in your life because you were 2 days away from, what the hell am I going to do to, I got a heart. I went into, and I thought everything was going to be good. And then the neuropathy didn't go away. It was almost like there was still this imprint, this thing that happened. And then all of a sudden it's like, then you randomly fell into this orthopedic. He started talking to you about regenerative therapies. And all of a sudden it's just like the pathway just unfolded for you in this beautiful, synchronistic way, right?
It does.
I always say this now, Mark. It's just funny. It's like you can't make this stuff up, right? You just can't.
No, you can't.
And so I want to talk to people because I'm not sure everybody, regenerative therapies have gone a long way in a short period of time. Like I'm familiar with them just because of my wife's health conditions. She had some torn labrums in her hips, and we've gone through PRP and stem cell, and it was the Wild West, like let's say 10 years ago, where she's getting spinal taps and like figuring out how to like get her own stuff and spin it and move it, and it was almost like I was in a sci-fi film, like moving it that way. And we've gone a long way since then, right?
Oh, huge, huge. And as a matter of fact, that's how I started out, kind of the same way your wife did, because my first therapy was actually taking stem cells from my bone marrow. And I remember the orthopedic looking at me and just kind of in a joking fashion, he's like, Mark, look, at the end of the day, with all the trauma you've been through, your bone marrow is garbage. But he goes, it's the wisdom of your body. And he goes, I'm going to have to mix this with something else, which is going to be more of a placental or umbilical cord type of tissue that basically has an element of youth to it, because your body has the wisdom, but we need the energy in order to start the repair process. And so that kind of clicked with me. And I thought, okay, that makes a lot of sense. So right there, in a sense, there's a combination of therapy that's already being developed that nobody even talked about. And frankly, Josh, at that point in my life, I had been in medicine for 18 years and didn't even know these therapies were available. And that was kind of how this turned into a passion project, because I'm sitting down there going, I'm in extreme pain. I'm miserable. Like, I don't want to make it sound suicidal. It was, you just don't want to be there living in that type of life. Yeah. I literally that's where I sat on the couch with God and I'm like going, is this some sort of sick joke? Like, you have me survive a heart transplant to be sitting on the couch now in severe pain, disabled, up on medication, watching Netflix for the rest of my life. And you have to realize I was 44 at the time. So I still felt like I had a lot of life ahead of me. So that's scary, to be going through all that. And so in that desperation, the mind just opens. And if you become receptive, these sort of solutions started to transpire. And I was just blessed that I walked into somebody that had already been doing stem cell research. And it started a revolution in my mind and started a revolution inside our company.
Well, I love that because, when we're receptive, right there. And I love how your orthopedic was already attached to the energetics of it all, right? He was moving, not just like cells in the body. Like the reason regenerative medicine works, which I don't think a lot of people understand, is the body knows. You're
That's
giving it
right.
these
That's right.
tools, this ammunition for the body to go heal itself. Like a lot of the things that I've learned over and traveled the world with is this whole process. This is why this version of the podcast is doing great right now, because it's blending ancient wisdom with modern science for
Yes.
true healing, right? This and I
Correct.
love your story's amazing, because all of us that are in this world to create a difference is there's a story attached to that, right? Like, oh my gosh, I'm
Correct.
sitting on the couch going, I was saved, I got a new heart, and then the question is this it, right? Is this it? Is this all that I got? Like, is there anything more? And then all of a sudden the questions started revealing answers for you. Like that, I just
Correct.
say it's part of the hero journey, right? This
It
journey of
is.
holy crap, it wasn't the heart. I'm still here learning what I'm supposed to learn. And now through my aesthetics and laser, you're looking at already regenerative things. So you already attached to that whole system, right? Of using these for
Correct.
practitioners. And then these new novel approaches of regenerative therapies came to you, you were healed, and now you felt compelled to help others, right?
That's correct. That's
And
correct.
that's
And you
it.
know
And
what? And
that's
that
where Rise Up Medical came from. So
that's
let's
correct.
dive in a little bit on regenerative therapies, because I think
Yeah.
practitioners, like you said, it's still kind of like, I wouldn't even call it fringy. It's not even pseudoscience, but a lot of people back in the day thought this stuff was only for like professional athletes. They'd go across the
Right.
country, they'd go overseas, they'd get these therapies, they'd come back. But now we're at the modern day side of this in our country, that
Correct.
you're providing these solutions to practitioners so they can now run. So let's talk exosomes, let's talk PRP, let's talk some of
Yep.
this language for listeners. We have practitioners that might be interested, but we also have people, and I want them to kind of understand that there's this new era that's out here, right? This isn't it's
Correct.
not it's accessible now, right? And we're getting cleaner, we're getting more advanced, we're getting these technologies to come through. And like you said, it's stuff that we're using to let the body go do what it's supposed to do.
That's correct. And I think an easy starting point is PRP because I think that's where most people are familiar. You go into an office, you present yourself on an injury. The doctor says, we've got a regenerative therapy that I think will work. It's called PRP. Well, PRP basically starts with you drawing your own blood down or drawing your own blood, spinning it down so that you can get that kind of platelet rich, the PRP side of things. And then what you're doing, you're getting all those regenerative or bioactive molecules that are in the platelets, and you're re-injecting them at a point of injury. At that point, the body literally goes back to restoring itself. Now, the challenge with PRP is the fact that PRP has a very limited amount of biologically active molecules that can help in that repair. And in a lot of repairs, there's so many different facets that could be involved in creating a final end result that we start trying to look at, well, what's the next best thing? And that was kind of what happened in my journey because when I'm looking at this bone marrow, I'm going, what's the next best thing? At one point, I hit a plateau. And we see that in PRP, that oftentimes people will hit a plateau because they're relying on their own body. And at that point, most of us are aged. And so is the blood that we're utilizing. And so it's just not as rich as it once used to be. So now we've got to go find a new source. So then we started moving into platelet rich fibrin. And that was where we were kind of starting to take that PRP and convert it back into what we would consider more of a plasma gel. What that did is that kind of created the sticky factor that you had with the platelets so that they would adhere and stay in place and work for a longer period of time. At that point, now you're getting this release of biologically active ingredients coming out of those platelets, and they're just there for a longer period of time, creating an even better healing than what we got with PRP. And then all of a sudden enters exosomes, right, Josh? I mean, this is kind of what that new evolution started to take place, is that exosomes now carry a even greater array of biological proteins that can create repair. And when we look at that, exosomes, to really kind of give you a little bit of a back end story, an exosome is basically a carrier vehicle. It's how cells communicate with one another. Just kind of think of it like a little bubble. And the way I oftentimes give a description is, think of it like a water balloon. And that water balloon is just an encapsulated envelope, but what's in it is all those rich biological ingredients. And so if these balloons will move from cell to drop off their ingredients and communicate with cells to help them restore themselves so that they function at a more optimal rate. When that cell then operates more optimally, it produces more proteins that it can then send around the body through these little exosomes or carrier vehicles to continue the repair process. And then ultimately, after exosomes, you start to get into stem cells, which stem cells, that is the powerhouse. And every stem cell has an exosome. So we're kind of using both in this field of regenerative medicine. And they're coming in different forms. They're coming in exosomes, which are just little packets of proteins that were in the stem cells, to acellular stem cells, which is kind of like, think of it as the collection of all the soup inside of a stem cell, but it doesn't carry the wall. It doesn't carry that balloon structure. And then you think of it as a stem cell, which is the entire structure. It's a whole living structure that can morph into anything. So it is, when you do this, that kind of becomes the hierarchy of what we're seeing here is PRP, platelet-rich fibrin, exosomes, acellular stem cells, and stem cells. And honestly, the acellular world is actually playing an even bigger role now than the whole cell stem cell. So it is, and these are things that are available right here in the United States, just like you talked about. I have friends right now that travel to Mexico, Panama, Costa Rica, not even realizing that the therapies are available right here in the United States.
Well, it's an interesting point, and the way I like it to really talk to it, pharmacists are really good at taking some complex ideas and bringing them pretty simply, right?
Correct.
We all know when we cut our finger, and that the finger heals, right? The finger heals because
That's right.
the platelets come in, they're full of good stuff, and the body just knows what to do. It's repairing itself. Sometimes we get a
Correct.
scar and it's over repairing and that type of thing, but we know that our body has the ability to send these immune response things in and heal it. And moving it from those, and then we're talking things like exosomes, which are packets of information. So just think of like, packets of information that you're getting in a download from your computer. It's like they're little packets and it's moving it and
Correct.
building it, right? It's kind of like a download.
Correct.
We all have one of these and we all get our uploads, right? Then
Correct.
you got the stem cells, and I want to talk a little bit about the acellular components, where this stuff comes from, and all that stuff. Is the stem cells are like the building blocks of everything, right? It's like they start from a stem, and then the body. This is how I love. Like, we have the most sophisticated system in the entire world, and it's called our bodies. It's like the body knows that it's supposed to grow over here and do this thing and do this thing. So when we're adding these stem cells to these specific areas, there's still this innate intelligence that we still don't know how.
That's exactly right.
And that's okay, because yes, I call it God, universe, spirit.
Yes.
There's something out there we don't know, but we know when we put these beautiful packets of information into a space that it actually helps heal. So what are we talking about here? Because we're talking aesthetics, but we're also talking regenerative medicine. In other words, there's a lot of longevity. People listen to this podcast and other podcasts.
Yes.
Like, what types of applications are you now seeing because you're providing these, let's call them substances for now, but these regenerative things to providers so they can in fact help their patients, right? So what types of things have you seen in this modern day with all this stuff?
It is, I will say this, because one of our products has an IRB in which it was actually a transplant cardiologist who was the lead investigator on it. And we were looking at both acute and chronic cases, and they evolved around cardiology, diabetes, autoimmune, orthopedic, neurological, pulmonary or lung, urology, aesthetic, viral, like you name it. If you just go onto PubMed or you go into nature.com or stemcell.com, you're going to find all kinds of literature talking about every application. Currently, we're working with physicians that are helping patients that are have ALS, MS, these autoimmune, both neurological type cases. And then we're going over to helping people with their sexual health, whether it's erectile dysfunction or it's female sexual wellness. We're getting into hair restoration. And recently we created a product using your own PRP where it's become a new biological filler. So instead of using a synthetic filler, now we can actually use a more natural ingredient to restore youth in any part of your body. So it is, and it just so turns out that those same applications that we're using as a biological filler can be modified to be used in orthopedics and pain management to start helping with pain related issues and ortho and joint related sports injuries. So if a stem cell created all, I think at the end of the day, these biologics, whether it's a part of it or it's a stem cell as a whole, is going to come back to play a significant role in restoring the majority of what we're dealing with. And Josh, you talk about it in your podcast as well. This is a supplementation program. And so when we look at this, all that we're really trying to do is supplement these sort of biologics back into the body because we already have the roadmap in order to get this done. And one of the big contributors that we see that's playing a crucial role is the development of inflammation in the body. And we know that inflammation ultimately equals disease. So if we can use something to try and reverse the inflammatory process in the body, then we can offset a lot of the disease from ever showing up. Or maybe even, I think, and let me say this, my ultimate goal in trying to bring education to this field is that we all die naturally and functionally. We don't have to die of disease. So at that point there, we're trying to bring awareness, not just to the biologics, but also the additional supplements that are out there that can play a role because stem cells, exosomes, they play one key role. I don't want to make somebody walk away from here and thinking that this is the end all be all, the Dyson vacuum that does everything. This plays one significant role. But when you've got over 3,000 different proteins that can play a part in regenerating the body, addressing inflammation, and creating repair, you've got this incredible combination for longevity and functionality.
Well, and it's funny because we're talking the functional lens, right? Regenerative medicine is a, let's call it a field. It's this place here that is got many tools. But if you're not like you and I are both talked about this offline, like it's wellness made simple, right? And the simplest fact is we have inflamed bodies. So if we're giving exosomes and we're giving stem cells and PRP and the fibrogen, and we're still not treating the body the way it's supposed to be, it's like you're never going to get the cycle fixed. And if diet lifestyle is huge, right? These metabolic diseases, these autoimmune diseases, everything is, if you want to look at it from this functional lens, it's really around that root cause, and that root cause can be stemmed as inflammation. And sometimes the mind can cause the inflammation. Sometimes the body is inflamed. Sometimes we have environmental concerns. So a lot of the times when I take on patient loads and cases, we address all these things, and there's maybe one smoking gun that's causing a downstream effect of a lot of things, but generally it's a lot of factors that are causality to moving down the line. This is why, when COVID came out and people were dying, it was because they have these comorbidities. It wasn't necessarily just a viral thing, and people didn't realize it's like heart disease, overweight, diabetes. These are comorbidities because all of those, it's not that you have diabetes or you're overweight or you have, heart condition. Those are metabolic inflammatory conditions that cause the body to already be underneath. So I love that you're framing this up as a tool, right? But if we don't get the other stuff done right, like you're not sleeping, you're not eating, you're not exercising, like all those factors happen. But it's like plant medicines today too. We have availability now in different ways where we can add these modalities now so you don't have to go across the world in some random place, pay cash to this place that's a little shady. Like we're doing this now in clinic settings.
Correct.
And it is bringing me back to my wife's journey and her healing, because I had to stumble upon this in a way that was accessible. And at the point, it was like we had to go across the country because nobody was doing it around here. And
Correct.
now
Correct.
we're able to procure these in a safer environment, and we're doing this beyond just med spa, but these stem cell therapies, these exosomes, like you said, bioactive fillers. So we're not using synthetics anymore. These are things where
Correct.
if we use them, hair regeneration. I'm working on a whole process around these things because now it's just regenerative. If we want to
That's
regenerate
right.
something, and I've been seeing these things where we're reactivating pancreas, like beta cell activity with some of these things. We're
Yep.
literally getting to the point where we can actually activate organ function again. Like there's some things that are like really coming in is really like I firmly believe, like with all the therapies we're talking about, especially with this, like the podcast, these are healing modalities.
Correct.
These aren't symptom management things, right? You were on
Correct.
675 milligrams of Lyrica, right? I don't even know how you're
Yes.
functioning as a human. I've been in the pharmaceutical world for a while. It's like they're just putting Band-Aid upon Band-Aid, and we're getting these doses so high, and all of a sudden you're like, what the heck is going on? And now you're 95% in the good, you're medication free, and
Mhm.
done with safe, effective treatments,
Correct.
and you're doing the lifestyle. So it's
Correct.
the whole package, guys. It's not just, this is not the expensive pill for the ill here, right?
No. No. And in reality, too, is this is part of the mission is that we're trying to scale this in a way. And the only way you scale it is through education and awareness. Because when we can scale and make this larger, then we make it available for everyone. I think a lot of times, too, people think that regenerative medicine is only for the rich. And I think you mentioned that in an earlier part of the podcast. And that's because at one point that may have been the case because maybe only the wealthy could afford a $30,000 to $50,000 infusion that would help them, and then they have to travel abroad in order to get that infusion. And now all of a sudden, as more awareness is coming about and more physicians are jumping behind it, it's allowing us as labs to scale down or to basically to scale up and bring the price point down on these therapies. And now they're making them available to all Americans, all people all across the world. I mean, this is a worldwide phenomenon. As a matter of fact, I was just looking into statistics, and it said that the regenerative medicine field, I think, is about a 23 or it was either 23 or $32 billion industry worldwide in 2023. It's expected to be 232 billion by 2032. That's massive. That shows you where the awareness is going in this industry and the acceptance. And once that's there, this becomes very accessible. It becomes very affordable. And now we have new ways. This is the advancement of medicine. And this is where medicine is going. And so we need as much as the patient to be talking to the physician as we need the physician to be talking to the patient. And that's how we do all this. That's what's beautiful about the podcast.
Well, I love the podcast because we can go long form. We can go deep dive into these rabbit holes. And I'm sure we could
Correct.
probably have a whole podcast on just one therapy, right? And one thing that we're
Correct.
doing. However, and the resonance here is, guys, it's like, listen, like regenerative therapies are not going away. They're getting better. And just think about like any technological advancement we had. I remember when I bought my first my first plasma TV, right? It was like
Yep.
$6,000 or something. It was so expensive. I can't even recall how much it was. Right? But I was
Correct.
young. I was making money as a pharmacist. I didn't care about anything. I was like, I want a big TV. It was going to happen. I still actually have that TV. It's one of my favorites. However, you can go to Costco now and buy an 85-inch TV that's about this thin for a couple hundred
Yes.
bucks because we perfected these things over time, right? And so you provide these solutions to physicians, right? So they can
Correct.
use this in their practice. And
That's correct.
it's not just aesthetics. We can use these in regenerative ways. And we can improve accessibility, because that's the thing is like
Correct.
we're going from 30 billion to 200 billion in a short period of time because they're not just novel anymore. This isn't pseudoscience. We're actually, it's like anything else. It's evolving in a quicker way because of our technological advancements, but we're still looking at it from the perspective of these treatments allow the body to do what it's supposed to do.
Well, and you know what, Josh, and you talked about COVID, and we at one of the research projects we had a double-blinded published study, and it was with patients that were in ICU during COVID, and we knew during that time frame you heard of the cytokine storm, which is basically an uprising in the immune system that really made it near impossible for the body to heal itself, and oftentimes led people into their ultimate death, and that's where you heard all the ventilator systems and all that sort of stuff coming about. What was interesting in this study is that we did half the patients got the placebo, the other half got 3 cc's of this acellular stem cell product. And when the research finalized, there was a 47% death rate in the placebo. There was only a 7% death rate in the acellular stem cell side. And what we kind of took from that is a couple of things that were happening. One is because we know that these biological ingredients are playing a role in suppressing the immune system, bringing it back into its natural balance so that then the other proteins can come in and start a repair process. So what it did is it gave the body time, and then it gave it the right resources in order to heal itself. And so, and then at the same time, they just as kind of like an off the site, trial, they wound up giving it the same product to the first line defense physicians that were in that ICU. And what they discovered through there too is that at the end of the study, 0 of them came up with COVID. Now, that wasn't part of the study. That was just an observation that was had after the fact. But again, part of it is it kept their immune system in balance so that it could fight. They're in the midst of people that are in extreme conditions with this COVID virus running around, and yet they're staying protected through the measures they're already taking through the hospital. But we felt like in a prophylactic standpoint that this was aiding in helping their immune system be more imbalanced. So it plays a significant role. And that's a published study.
Yeah. And I think this is important is like, we're not talking, cure here. We're really
Correct.
focusing on when we give the body more of the ingredients and more of the pathways towards hormesis or balance. It's going to, it wants to, like, we all know we have the innate ability to heal. Like there's the thing, we've all heard of spontaneous healings. We've all heard of, I've seen them. Like I've been in rooms where just by thought alone, somebody's actually healing themselves. There's different ways that we can look at. I'm a big Joe Dispenza fan. People know that about me. Like there's so many different ways that the mind body can do these things. But when we're actually isolating certain things that we can put at a certain site, like I'm thinking shoulder, right? I'm thinking all these different areas where people have had these major issues. And now it's, rather than talking about anti-inflammatory and fixing and replacing the part and moving it in those, like, I'm just sensing and feeling like we have this renaissance that's about us, where regenerative support through modern technologies, but also, again, let's use the body to do what it's supposed to do. Let's give these new and modernized approaches, and let's go back and make sure that we're doing all the basics well. Like I think it's like it's the newer formula, right? It's not just and you've grown exponentially. And in talking about this is, this RIZE method that you have, that you're moving people forward in this way, and it's really important because this is the I love this podcast because I want to give people a glimpse of the future. But the future is today. It's not like we're waiting. This is not science, like sci-fi. Like in 20, 40 years, we're going to be doing this. It's like it's happening right now. And I think we're so closed because we go to the hospital, we go to the doctors. There's nothing wrong with allopathic medicine, but it's not it's not centered around healing and regenerative help and longevity. It's really looking around the sick part, right? Not the well care
That's
part.
right. That's right.
And physicians can, we know that we're in this process where the sick care system is the payer, right? The payer system. But now we can create this hybrid approach where, you might come to the pharmacy or the doctor and your insurance pays for a portion of that. And then you take charge and you say, you know what? I'm going to take my own healthcare into my own space. I'm not going to just do what's covered. I always tell people your insurance pays for you to be sick, not to be well. Just like
That's
your
correct.
car insurance
That's
pays for
correct.
your car to be fixed when you crash it, but it's not going to pay for the oil change. It's not going to pay for the tires. It's certainly not going to pay for the car wash or the good gasoline. You kind of have to do that yourself, right? But and
That's right.
the cars that are around for a long time are being well taken care of. And so we have a
Correct.
hybrid model for our own health. And I think people are so stuck because of all the money they're spending on this side to be insured and all this stuff. It's like, but if you focus on just a portion of that over here, you can get these
Mhm.
things done in a way that's, like I said, it's just that it's this new era I think we're in.
That's exactly right. No, and as a matter of fact, you were just kind of talking about you were talking about the longevity side and where we're playing in this, as medicine continues to progress, one of the things that we're starting to see now is that the evolution of a biological age versus our real age,
Oh, I'm glad
and
you
we
went
see a
into
lot
that.
of these. Yes, exactly. Because it's as people start doing a lot of these therapies and they start going back and looking into their cell structures, and you have these things called telomeres. And it's kind of, I always tell everybody, you can tell the age of a tree by the amount of rings that it has. You can tell the age of the body by how long these telomeres or the ends of a shoelace are. And what's happening is we're seeing that these biologics are playing a role in extending these shoelace endings that are showing people having kind of seeing an age reversal. They're coming up with a new biological age. So you could be 60 at your actual age, but you might be 55 from your biological age. And that's the ultimate gauge, right? It's how do we get to 100? And I always say this, 100 in a functional fashion, because frankly, if you talk to somebody who's in their 60s now who's sick and you ask them if they want to live to 100, you're not going to get a reply of yes. But if you take an active person who feels in their best life at 65 years old, their aim is 100. I mean, even for myself as a heart transplant patient, I think the longest heart transplant that's been out there to date is maybe somewhere around 35 or 40 years. My whole goal at this point is to beat that because of these type of medicines. And a lot of times too, I think why the proactive stage is so important is because medicine, I heard a statistic recently that said by the time a physician ends medical school, the medicine they just learned has already changed 71 days later. And now you incorporate the artificial intelligence side into medicine, and medicine is going to advance in a very rapid rate because we're going to find a whole new subset of proteins that are playing a significant role. And as that time goes on, you don't know if you are a day away from an advancement that will save and extend your life or whether you're a year away from seeing your life extend. But the reality is, this medicine is going to change things, and getting to 100 is not going to be unheard of any longer.
Yeah, and it's I love that because like my whole tagline has been live better, stay well, right? It means stay
Yes,
well. It's like we want people to live vibrantly and then fall off the cliff as soon as they're going, right? It's like I want to live as
that's right.
best I can, as long as I can, in a vibrant way. And as soon as I'm ready to go, it's like boom, I just want to go down, right? It's like end race. When I love that you brought up biological age, and yes, we can test for this now. I test
Yes.
for this in my longevity protocol because I want to show people that they can, their biological age, not their chronological age, is
Correct.
the age that we are. And you can actually start seeing that reverse and move backwards in a way. And when you get the body, the mind, and the energetics in alignment, in coherence. This is why I teach heart math and HRV and heart rate variability training.
Yes.
So we can get the body and the mind in these coherent patterns. And we're doing these regenerative and longevity protocols and things. it's not terribly complex when you're doing it in the right sequence and in the right fashion. Now, do you have to invest in your, like you've invested in your education, or you're investing in your portfolio, or you're investing in your business? Yes. This is what I love to invest in themselves, like they've invested in every other avenue of their house, in their health.
Correct.
But going to have more vacations, you're going to have more time off because you're going to
That's
live
right.
longer. We want that.
That's
But
exactly right.
so I love the fact that we brought in biological age, because yes, we can test the telomeres, we can test all the genetics and the genomics around this, and it doesn't cost a lot either. For a couple $100, you can test your biological age. And what I love is the test, treat, test protocols. It's like, let's test you now, let's move you down the line for 3 to 6 months, and then we'll test you again. And then you get this validation. You're like, holy crap, I'm like 5 years younger than I was. And
Correct.
it
Correct.
does,
And you know
it
what?
works.
It does. And, Josh, I think you bring up a very interesting point, because we talk about, why is there not as much awareness in the regenerative space as there is in the pharmaceutical space? And, you kind of bring it about because this space, regenerative, because there is no patentability of a biologic product, that what happens is most of the work that's done here is being done through self-patient cases. Physician comes in, does the test just like you talk about, treats the patient, then tests again, and all of a sudden gets their validation to what they're doing works or what adjustments they have to make. There's not billions of dollars flowing through like the pharmaceutical industry that can then, find this particular pharmaceutical drug and then take it to market and advertise like there's nobody's business, to create this large awareness campaign. So a lot of this is all happening through people like you and me, who were true test cases. I mean, we're not only are we helping other people, we're doing these sort of things ourselves, and seeing those changes is what gets us excited about this field. Because I mean, I'll just give you a perfect example. About 2.5 years ago, I could barely walk upstairs because I had got a little bit of a bone on bone, kind of like my cardio was wearing down on one side. And it was every time I would step up a stair, it would literally grab my knee and start to give out. I mean, it's embarrassing trying to go into a movie theater anymore to try and walk upstairs to go see the movie you want, and you look like you're a cripple. But I wound up doing a variety of therapies just to try and test which one was going to get me there. And we talked about exosomes and acellular stem cells. And one of the things that I always want to say to this one is, one of the things we found when we're looking at exosomes is that exosomes really are good for more acute related cases. When you're dealing with more chronic related cases, that's where people have to start working down into the acellular side of things. And the only reason for that is exosomes carry a smaller subset of proteins in order to get the job done. Where acellular stem cells, they carry a far vast amount of proteins that will get the work finished in a chronic related case. So in this sort of case here for myself, I started out with exosomes, and what it did is I still had the catch, but the pain of the inflammation has started to disappear. So I felt a little bit better and thought, I'm outside of the woods. But very quickly after that, it came back. And after playing around with it time after time doing exosomes, I realized I'm just jacking around with the wrong thing. And so I moved up into a higher level and realized in 1 to 2 treatments, I knocked out my knee issue to the point where now I have complete mobility. I'm back out there lifting and squatting and doing all kinds of things pain free, running up and down stairs. But I had to align it with the right product at the same time. And the challenge is sometimes in this field, there is a gravitation towards the most economical fashion to get it done. And a lot of people in the field also they feel like salespeople when they're talking to patients. And so they kind of clam up in terms of what is their true, you know, what can you truly accomplish? And what I find is that if you treated this like you were making a prescriptive, discussion, you would not undercut the medicine that you put them on just to try and fit their pocketbook to try and get them somewhat well. You'd want to give them the full prescription and tell them to follow it out. And in this case here, what we're seeing is people are just kind of cutting corners to try and make this economical. But if you align the right product, you align it with the right dosage, then all of a sudden that patient gets well and gets back to more functional life. And I know that's a little bit of an offshoot of our conversation, but you triggered a thought in there. And I always want to bring that back up because there's so much happening in this regenerative field. And we have to really make sure that we have a confident conversation with patients so that they don't just buy into a partial therapy, that they buy into the whole thing. And when I talk to practitioners, a lot of times I say, look, if you were trying to remodel your house and Lowe's came by and dropped off a quarter of the materials to get it done, one, you're either going to have a really nice part of your house and the rest of it's going to lay vacant, or you're going to have a crappy job done all around your house and it's never going to be complete. You're not going to be satisfied with that job. So in that realm there, I go, don't treat your medicine the same way. If you want to get the result, then you got to go for the result. And so that's where, dosing and trialing and dosing again becomes the appropriate factor. And I don't try to tell everybody that this is a one and done. I mean, I've had parts of my body that I treated that was one and done, but I've had parts of my body that took 2 treatments in order to get it done, or maybe even 3 treatments, because you don't know what the severity is. And for me, I walked through a very traumatic experience where my body was dying and I didn't even know about it because I was working at half heart function. I just thought that was a getting older experience. And instead, later on, as I'm trying to do all this diagnostic testing as to why I'm getting neuropathy, I suddenly find out that I have a heart issue. But when your body is breaking down, even from a heart perspective, what a lot of people don't realize is that blood starts to retract and go back towards the organs because it's trying to protect itself for survival. So what happens is the limbs start to degrade. So I was losing feeling in my fingertips. I was losing feeling in my feet. I actually lost feeling halfway up my calf, almost to my knees. And through the regenerative medicine, again, I dabbled in my own stuff and kind of got myself there. And I could tell that it was on the right path, but it was when I really stepped in and said, okay, let's do this right the first time and give myself the right dosage. It was more expensive for me to get it done, but in the long run, it actually cost me a quarter of what I was spending before. It's just about making the right choice up front. And we just have to have practitioners and patients both be willing to make the right choice up front. Otherwise, you just feel like you're coming back from the same thing over and over and over again and never accomplishing a result. And frankly, that gives the regenerative medicine business a bad name. A lot of it is just in the conversation. If we have the right conversation up front, this goes splendidly well. And you have people running around like you and me who are living our best lives in a totally repaired and regenerative state.
Well, it's important to say, because I say that in nutrition as well. It's like optimal dosing is where we get results and outcomes. We don't get it from like,
Right.
oh, I'm just going to skimp here. I'm going to take half the dose. It's like, there's a whole thing we could talk about in the clinical nutrition world about optimal versus minimal. Because I think that people don't realize that the RDA, the recommended daily allowance for all the supplementation, is the amount you need not to get the disease associated with that.
Right.
So we don't get rickets anymore or scurvy, but we got to make sure we're getting optimal doses. So we're flooding the system, we're flooding the body full of these things. So how do providers get the education they need in order to start this process of finding the sweet spot? Because we do want to nail it more often than not. And yes, it's a journey, guys. Not everyone's going to respond
Yes.
the same way because there's magic amount of like billions of signals going on. And so we've got to play with this journey that we're on. And we also have to do this with the most up-to-date targeted approaches. But you sell to practitioners. How do we educate our practitioner base so they can even get to the table here to start this process of awareness and understanding?
Yeah, no, and and I think some of the responsibility does start with us at the same time, meaning the labs doing the proper research, trying to go through the right FDA channels, doing all this. But part of it too now is we're all trying to work through these FDA channels. The is pulling from research that's already done there, trying to give them a good understanding of what's out there. So I want to give you kind of an example. Japan had a study that came out that showed that they felt like they had the cure to Alzheimer's. And then when they started to go down the protocol, it turned out that there was like 175 million stem cells used and was used over a specific period of time. And all of a sudden, somebody looks at that study and says, hey, there's a cure to Alzheimer's, and all you have to do is use stem cells. Well, no, you have to pay attention to the dosing side of this at the same time. And in most cases, that may have worked in a clinical setting, but the reality is very few humans could actually pay for those type of results to get what Japan accomplished in that study. So I think we have to bring awareness to those studies. And in those studies, sometimes we find that there is the magic bullet. And then other times we find out, hey, maybe there's some other ways we have to go around this because that study represented a curative fashion. And I don't really want to say the word cure, but that's the way they put it in their study. But maybe there's other avenues that would actually get us to those results. And so a lot of it right now is going to be through awareness channels like what we're doing here. I think the other part too is going to be through studies that we're doing inside the labs. And I think the other part too is that physicians, we want them to go take a proactive look. The publications are there. It's where I pull a lot of my own research. I read these things time and time again. When a patient presents themselves with something, I want to understand the disease state. I want to understand what was used, what the outcome looked like, so that when they go back there, you can share this stuff with the physicians and they can kind of get a better base of how to communicate with the patient. Because honestly, it's that unknown period that is why most people are undertreating. It is. And so luckily for us, we had a lot of, we did study. I mean, we had an IRB that had 5,000 patients in it. We started to get kind of a common ground of what worked. And so within certain subsets of our products, we kind of know what that range should look like. And honestly, it's not as much as you think. And that's the reality. And it just comes from a conversation.
No, that's beautiful. So you're helping providers get educated. You're helping them move in this realm. You're showing them that the science is there because, everything we do is backed by science. It's not pseudoscience anymore. We want to make sure that people are understanding there is this new age of medicine that's not typical. Well, let's just not call it typical, but it's there and it works, right? That's part of this process is when we get the formulas and when we're on the right path, things start to align, right? And sometimes some people's path is different than others. But now that we have these, we want to make sure that we're educating the patients, we're educating the providers that these are thought. I've had this question so many times, and I've had people are saying, "Well, I got this." I was like, "Have you tried regenerative therapies?" And they're like, "What is that?" And it's like, "Okay,
that's right.
Let's talk about it." Like there are things you can do now that are very, very in the right place at the right timing. It's an exciting time, so we can use these things to our advantage. What is what are some steps listeners can take today to start embracing this more holistic healing component?
Yeah, as a matter of fact, I'm going to say the first thing that I always tell people is be an advocate for yourself. Don't just accept the first answer. When you walk into a practice and somebody says, well, this drug is going to be your best choice or surgery is going to be your only option, I would actually challenge them to talk to their practitioners about regenerative medicine. And here's the thing too, I always want to preface this because it's not always, it's not the physician's fault at the same time. If you understood what a physician goes through on a daily basis to just try and run and manage a practice, most of what they can handle is what's in front of them. And they don't have the time to go out there and do a lot of the added research. A lot of choices of physicians that have gone into regenerative medicine are those that are tired of the sick care and they made a choice to move from sick care into something that's more of a proactive care. So now they're engaging in these different forums and whatnot and different conferences in order to learn about all these new therapies. So I think the part of it don't be tough on your physician, just engage in a conversation. And I think watching things like this, Josh, like your podcasts, are critical because it's got to give them a base understanding so they even know what to talk about when they go into their physician. But I will say this, I am not anti-pharmacology and I am not anti-surgery. All I'm looking at to try and really share with people is that this could be a first line defense for a lot of what we're dealing with that could help avoid surgery or could avoid or offset when the medications are used. Because frankly, I'm a heart transplant patient. I also have had back surgeries. I couldn't have done it without those surgical interventions. But also, I can't live unless I take a certain, drug. So there is good applications for it. And then there's areas where maybe those drugs aren't playing an important role. But when it comes to our longevity and regenerative style, regenerative medicine is going to play the key role and the supplementation that comes out of there. And I think it's more of a proactive approach too. So
Yeah, and that's the point, this podcast is beyond the pills, right? It's what can we do other than? And that it's
Correct.
not the practitioner's fault. It's not the surgeon's fault. It's not
Right.
anybody's fault because they're just trained in a specific way. I think
That's
most
right.
of the holistic or alternative, I don't like the word alternative anymore, functional approaches,
Yes.
um, there all starts with conversations where the provider that you're seeing is open to other things. They may not be
Correct.
the expert in regenerative medicine, but having a provider that's open to having discussion is, like you said,
Right.
I think is like my wife would have, like, the first thing we said is, what are the non-surgical approaches? So we went to the physiatrist, which is his job to talk to you about these non-surgical approaches. And then
Correct.
a lot of this, guys, happens to be like, oh, I heard it here, I heard it there. I was in a conference in for compounding. We were doing pain medications with compounding. And some guy was just got up there and he started talking about ozone therapy and PRP. And it was like, I've
Correct.
never heard this before. And I just happened to have a really complex case that I happen to be married to. And I was like, I'm open for these things. And I went up, I talked to him. He was from Cincinnati. My wife was from Cincinnati. I said, you know what? Let's fly there and let's just see. And we talked to
Yep.
him and we ended up getting treatment. And it was beautiful. And it worked. It was like one of the things that actually helped repair a torn labrum that she couldn't figure out. The other solution would have been surgery, which would have been 50%
Hmm.
effective. So we
Correct.
we got through it because we were open, right? This is the first phase. Like I always say, awareness is the first step. So if you're listening to this, just be aware that these are options for you and you can open these conversations up and talk about these other things. It's not like you and it's there's an and, right? Like you said, I still need
Yes.
some medications for my heart transplant. I need, I've had surgeries before. So this isn't this or this. This is not the duality of the world. It's like maybe you need this and this, or maybe we try this first to see if this is the secondary process, right? So
That's
I
right.
love the
That's
word
right.
and because we got to put this all together in the whole component, right?
Correct. Correct. This is important for us to all play together and just know where one puzzle piece fits before the other. So to your point, and I saw this even with my wife when we first started dating. She was dealing with a back issue where she was even walking with a cane, and kind of similar in a situation where I tried to bring the regenerative medicine side to her at that point, and she looked at me and said, "No way, I'm going to the best back doctor. We've just dated. I don't know you, And it's like, and I'm like, but just hear me out first. I just need you to open your mind to this whole process." And when she went into her back doctor and they said, surgery is your only other option, and we're going to set you up for this, the first thing she comes back and says, "Hey, maybe we try your side first just to see." And all of a sudden, that was the moment her mind became open because the reality that surgery was her only option started to scare her. And when we started to go do her regenerative medicine, do you know what was the very thing that was her issue? It wasn't this bulging disc that they wanted to cut out for her. It was that she had developed arthritis in her facet joints. And in those facet joints, it's just kind of like the oil man from the Wizard of Oz. Once it starts getting rusted, it doesn't move properly. And then anytime you move, it starts to create an agitation. Well, as soon as she did the injections in her back, the arthritis disappeared and her mobility came back, and she never had to undergo surgery. And that case happens more than not. And that's the reason why, like, we try to work really big, even in the orthopedic and pain field, is bring awareness to it. Just might be that these joints have to be oiled to reduce the inflammation or arthritis that's developing in the joints that could be the end all be all for them and return them back to a functional life. It just doesn't mean that it's surgery is the only option. And in a lot of cases, I'd probably say 80% of the cases that I talk to never wind up going to surgery. It is something as simple as arthritic development on the joints.
And I think a lot of people just, again, like, let's make it clear here. Like there are options,
Hmm.
right? These are just options. My wife had a bulging disc.
That's right.
She healed it through not PRP, she healed it through Pilates. She figured out a way that worked for her, right?
That's
And
right.
so this is what we're all about here. It's like just listening to these, you know, like, and I've been aware because I study this so often because I want to know the things that are when we talk regenerative, we're talking things where we're actually helping the body heal. And I'm all about healing and transformation these days. I'm not about symptom resolution only, right? There's steps
Correct.
in this space. And let's make this as a let's put the gas on the awareness because that's the first step. So where can
That's right.
people go to learn more?
It's we have a website called riseupmedical.com, and it's RIZE. The Z was actually developed because that's what we were trying to do is a Z can be elevated. So we wanted to try and elevate patient care and patient results. So riseupmedical.com will start an initial. I want you to also understand when you go to our website, we're more of an education company than anything else because it's the way that we have to work within the regulatory framework. But I think the other key part is just start having conversations with your practitioners about this, watching more things like Josh's podcast and other people that are trying to bring these regenerative medicine sources to the, and then also you can find us on our social media at the same time, which is at Rise Up Medical. We're on Facebook, Instagram, LinkedIn. So these are other channels which you can follow us on as well to get more information.
That's awesome. And we've got testimonials, we've got people
Yeah,
telling their stories because it works. It's not like we're
it
we're
does.
we're not trying to sell snake oil to people. Like we're
That's
actually
correct.
here to introduce these new therapies and frankly that most physicians aren't aware of as well, that there's accessibility, that we can be doing this, that these procedures aren't as archaic as they used to be, right? Like going
Correct.
into a
Correct.
bone marrow and spinning it out. And like, I've been through that process. It's not
That's it.
easy. It's not
No.
fun. It's
No.
not cool. It's really difficult. And now we have this more turnkey approach that can be more useful, little less energy component to that. That
Correct.
really helping people. So Rise Up Medical, go check that out. Um, talk to your physicians, talk to your family, talk to people about like, have they gone
Yes.
through this? Like, this is how this stuff starts to work when there's a little bit more emphasis on these alternative, let's call them functional approaches that, we can take these really expensive surgical interventions that sometimes like they're not just the only option anymore. So we
Correct.
also have
Correct.
people to just go do their own thing. Like let's talk to the providers. Let's look up the research. I love that you quoted Nature and PubMed. Like these are places that are actually, it's really difficult to get into Nature. If you're published
Yes.
there, it's not like, oh, I just talked about this supplement and it works. It's like there's peer reviewed, they're white papers, they've been
Correct.
massively scrutinized by the medical community. If you're in these top publications, it's already worthwhile science. So
That's
I'm glad
correct.
that we
That's
put
correct.
awareness to that. Um, Thank you for what
And
you're
Josh,
doing, Mark.
too.
It's amazing.
Well, thank you, Josh. I appreciate that. And I just wanted to bring one more thing in there. On our website, you can go to an education tab where anybody can go. And we try and take the complex subjects in there and break them down into something very simple. And for practitioners that are listening to this, they can also set up a time with us directly on the website to where we can dig a little bit deeper into what they're doing and the things that we might be able to help them with to help their patients. So, and Josh, I'm grateful to you because we can't do this to create an army. We've got to come together and create this level of awareness. So I'm grateful to you for the podcast and the opportunity to come on here.
I love it, man, because, like I've been teaching pharmacist wellness for so long. Like you don't have to be into this, but if you're aware of it and your patients
Correct.
are coming in and they're on opiates and they're on all these NSAIDs and they're on all these medications, they're coming in every month, they're not getting any better. And all of a sudden you could just have one open conversation. Says, have you heard of regenerative therapies?
That's right.
No. Okay, well, let's get you some more information. Let's get you off some of these medications that aren't serving you. Like that's our big goal is to get people deprescribe unnecessary medicines. Not all
That is
medications are
exactly right.
necessary if you can get the body to heal itself.
That's correct.
Well, thank you, Mark. I'm sure
I
we'll be
appreciate it, Josh.
in many, many more conversations. I can't wait to dig in and start referring more providers to you, because this is the wave of the future, and I'm really excited to be on this journey with you.
Oh man, me too, Josh. Thank you so much, my friend.
All right, guys. Until next time, stay well. Thanks for joining me today on Beyond the Pills. If our mission to de-prescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.